antifungal in preservative media, and then Sunita will present about pre-cut tissues. So Arvind has shown all the constituent of preservative media. All of us know we have in Optisol, Cornisol, all we have antibiotic, no antifungal. But in organ culture media, there is antifungal already. So whatever I am describing, most are like people are still doing experiment. It is not commercially available in Optisol. But we know because of the lamellar surgery, the keratitis mostly due to candida, it has grown. It is increased from 0.014% to 0.023%, and most commonly it is candida, and that too lamellar surgery. So why it is more in EK compared to PK? Because there is a more processing and additional warming period, and lamellar interface is more challenging to treat because fungus stays in the interface, more difficult to diagnose and more difficult to treat also. If you see culture positive fungal reams per 12%, in cases with candida, 14% cases with positive ream culture can develop clinical infection. So there is always a need to add antifungal in the media. If you see PK and EK, then maybe the bacterial, especially in our country, bacteria is more compared to fungus. But if you see only endothelial keratoplasty, and if you compare whole Western, whole world, then fungal. But in our scenario, if you bacteria is more. So coming to Optisol GS, there is streptomycin and gentamicin. MK media only gentamicin. In organ culture, there is amphotericin B. So fungal recovery rate in antifungal supplemented organ culture media is lower than non-antifungal supplement. So both voriconazole and amphotericin B has been tried. But nothing is like everything is all publication stays, nothing is added. Maybe one is safety efficacy has been tried, but dosage also has been decided. I feel the one is cost, because cost and when to put and how long is stable. And so what is the dosage and efficacy? Any drug, there will be efficacy and safety profile. So in this study, the voriconazole was added in Optisol GS, and you can see the 7 out of 533 cornea were positive for fungal organism in plain Optisol, whereas when it is fortified with voriconazole, there are no reams which are positive. There is no difference in cellular morphology, so that means it is not very toxic also. But this study again says that candida, they have taken only candida and candida glabrata, so no growth in amphotericin B supplemented file. Whereas in the previous one it was voriconazole. And this endothelial toxicity when you increase the concentration. So you need to find a dosage where the efficacious but least toxic. We did a similar study in MK media where we took 5 concentration. In fact, we saw first day, 4th day, 7th day. But wherever it went to reviewer, they asked the question, if the MK media is for 4 days, why do you check it 21 days? So we removed those part and published. But the main idea is that when you collect cornea, you can't keep on adding everything. If the drug is there, then you have to see for 1 year. In fact, I wanted to see the stability of the drug I went for HPLC, but then I stopped the idea because all the reviewer, the question was, why do you check at 21 days? So here also we took 3 because candida is not the most common organism here. So we tried Aspergillus, candida and fusarium. Again, we found amphotericin B significantly reduces fungal contamination. Even the cost-wise also, amphotericin B is cheaper than voriconazole. So you can see the amphotericin B concentration, the lowest, and day 0, you can see here, candida albicans in 20 microgram, it is 0 in day 4. And even the 2 microgram also it is 0. Whereas in voriconazole in 100 microgram on 4th day it is 0. So these are the published studies where they have, the first one is voriconazole, but there's the significant reduction in positive ream culture, there's no endothelial toxicity. Whereas the another study, they have amphotericin, they found significant reduction, whereas voriconazole no. And it is higher concentration, there is endothelial toxicity. We found amphotericin B is superior superior to voriconazole. We are yet to publish the endothelial toxicity. So, what is the optimal concentration? This study says that for Candida albicans, the concentration is more than 1.25 microgram, and 2.5 reduces more than 90% after 6 hours of cold storage. So, this study they've added at different points. One group did not add anything. The first group they've added when they get the cornea. The second group, it is like they simulated a situation where it is a dissect. So when they prepared the dissect lenticle, they have added second time. The third one, like one group got twice when they collected as well as they prepared. One group did not get anything. One group got only when they collected. So finally, the conclusion was where you have added twice, that efficacious is more. So in 0.225 microgram is effective, and we add twice. So basically, we need antifungal. There is no doubt in that. And amphotericin is more effective than voriconazole for Candida. We got in all for Fusarium aspergillus also amphotericin is more effective than voriconazole. And 2.5 microgram or amphotericin is safe and effective doses. But probably this is not, maybe you need regulatory to add anything new, and cost. When do you add? If you add during preparation, then it is cheaper rather than adding every time when you collect the cornea. And then how long it will stable. You need to stability also, that the solution is stable, that concentration is stable till the 1 year and the end of 1 year shelf life. But some people may finish, but those who keep the media for 1 year, the drug should be stable in that. Yeah, the level for 1 year. That's why I wanted to know whether 3 months, 6 months. But the reviewer is almost all reviewer asked, why do you do till 21 days? If the MK media is for 4, tissue can stay for 4 days, why do you check it? No, I did not check stability. I wanted to check the efficacy. But the fungus almost died due to cold temperature also. Because most of the 21 days it is working. Whereas tissue is used in 4 days.